Welcome to the election process for the 2021-2022 APHA-ASP National Executive Committee. To challenge the national officer candidates' ability to think on their feet, the current APHA-ASP National Executive Committee has developed 3 predetermined thought questions for each of the candidates to answer. You will now hear from Justin Bladecki, candidate for office of Speaker of the House from the Rosalind Franklin University. Justin, your first question is, what is one unique aspect of APHA-ASP as an organization, and how would you promote the utilization of this aspect to non-member student pharmacists?
Thank you for the question, Juan. I would say that one unique aspect of APHA-ASP is our size and our versatility. They go together. Because we are the largest association of pharmacists in the country, and we are the largest academy of student pharmacists in the country as well, we have numbers that can be more useful in reaching patients and in reaching legislators. So we have patient care and advocacy that both come from the fact that we have a very large body of pharmacists and student pharmacists to work with. Going alongside this is our versatility. While other pharmacy organizations may be more specialized and have very focused areas where they can really shine in a single area, we draw from everywhere and all practices of pharmacy. In my own experience, when I was in the military, I was in the National Guard actually, and we had a very similar situation where we were able to draw from a collective body of knowledge that was not specialized in one area. Because everybody had our military profession, we also had our civilian professions. And so when it came to a point where it would be helpful to have a mechanic or an electrician, we would simply go to the people who had those professions in the civilian world. I would like to promote the versatility of APHA-ASP by encouraging pharmacists and student pharmacists alike to think about what they do outside of pharmacy, outside of our immediate practice areas, and think about how we can develop those skills to better provide patient care or better provide advocacy for our profession. Personally, I have a bachelor's degree in comparative literature. And what I have learned since I started pharmacy school is that the reading and writing skills that I developed over the course of earning that bachelor's degree haven't left me. And I am able to shine in areas of drug information and communication in written format. And I believe that other people have very similar skills, maybe not the same as me, but have skills outside of what we would immediately expect for pharmacy, that if they are able to find a way to implement them, will improve patient care and improve the profession of pharmacy.
Thank you, Justin. Your second question is, in your opinion, what do you think is the most pressing issue facing healthcare today, and what can we do as a profession to address it?
Excellent question. There are a lot of candidates for the most pressing issue facing healthcare today, but I believe that without doubt, they all revolve around the rising costs of healthcare. I believe that we have an ethical responsibility to provide quality care for all patients, regardless of income. I believe that as a profession, what we need to be doing is advocating for healthcare systems that put patients over profits. We need to be advocating for professionals to be responsible for making financial decisions, as opposed to simply people who have business degrees. There's nothing wrong with a business degree. but we need the people to have had professional healthcare training as well. We need people who have an ethical responsibility to care for patients to be involved in making these financial decisions. And I believe that we should be working with other healthcare societies to truly expand policy and promote policies and legislation that moves healthcare towards accessibility, excuse me, towards accessibility in a way that makes healthcare available to more people at high qualities and puts our financial income not discarded completely, but at least second to patient care.
Thank you, Justin. Your final question is, how do you think the current pandemic will affect the scope or practice of pharmacy moving forward, and what opportunities would you advocate for to move pharmacy forward?
I don't like talking about the pandemic as if good things have happened from it. But the reality is that everything that we see in the world has good and bad come out of it. If the pandemic has done nothing else, it has highlighted the impact that pharmacies and pharmacists can have in community healthcare. It has demonstrated our knowledge and shown how competent and capable we can be when we are utilized to our full benefits and to the top levels of our training and knowledge. We have also exposed weaknesses in our healthcare system, and we have a much better understanding now of how we can provide telehealth services and what services really shouldn't be done through telehealth. As far as moving the profession forward, I think the most important thing is to continue the conversations that have come up well beyond the end of the pandemic. We need to be reminding other professions, we need to be reminding our representatives and our senators that we were able to do this during the worst health crisis that we have seen in our lifetimes. And we will be able to continue to do these things when the situation gets better. I believe that getting pharmacists involved in healthcare through the pandemic is going to have opened the doors for us to being more involved and continue to pushing the practice forward. The emergency declaration that has allowed us to immunize across all 50 states and most age groups will expire. But because it happened, we will be able to continue the dialogue and remind our representatives that we were able to do it then. We can still do it now. You just have to allow us.
Thank you, candidate Bladecki. This concludes the interview portion of the election process.